Greetings, scholars, and welcome to Following the Gong, a podcast of the Schreier Honors College at Penn State. Following the Gong takes you inside conversations with our scholar alumni to hear their stories so you can gain career and life advice and expand your professional network. You can hear the true breadth of how scholar alumni have gone on to shape the world after they rang the gong and graduated with honors, and learn from their experiences so you can use their insights in your own journey. This show is proudly sponsored by the Scholar Alumni Society, a constituent group of the Penn State Alumni Association. I'm your host, Sean Goheen, class of 2011 and college staff member. If this is your first time joining us, welcome. If you're a regular listener, welcome back. Dr. Eric Gibney joins Following the Gong to discuss careers in medicine and organ transplant science and care. Dr. Gibney graduated from the Eberly College of Science in 1994 with a BS in biology and with honors in nutrition, and then earned his Doctor of Medicine from the Emory University School of Medicine in 1998. He now serves as the director of the Piedmont Transplant Institute in Atlanta, where he specializes in internal medicine with a focus on nephrology and transplant care, with a special emphasis on kidney transplants. Eric shares his experiences at Penn State, including line ambassadors, lifeguarding, and the Disney College program, before turning his attention to giving insights on med school and mentorship. He also shares an overview of the transplant process, making this episode of interest to any scholar and not just those interested in healthcare. Eric's full bio and a detailed list of topics are available in the show notes on your podcast app. And with that, let's get into our conversation with Dr. Eric Gibney, Following the Gong. Joining me here today from Atlanta, Georgia is Dr. Eric Gibney. Eric, thank you so much for coming on. As always, to set a framework for our conversation, let's talk about what brought you to Penn State and then the University Scholars Program all the way from Platteville, Pennsylvania and the Governor Mifflin School District.
Thanks, Sean. I'm really happy to be here. As I was saying, I listen to a lot of podcasts now, and it's fun to be on the other side. So happy to join. Probably like many people, my journey at Penn State started with a football game. So and then backward into the scholars program. So I was a first generation college student at the time. My parents went to school after my brother and I did. And so in 10th grade, we had family friends that asked us if I wanted to join them at a game. And I was like, sure, sounds great. And it turned out to be November, and it was had to look it up. It was 1987. It was the Notre Dame game. And so it was a big one. It was a night game, and it snowed somewhere after halftime. And Notre Dame was on a pretty big winning streak and was poised to go to like the Orange Bowl or something big. And Penn State upset them, and it was just a joyous occasion. And then, fast forward a year or so, I was looking at colleges, decided to apply to Penn State. And then, you mentioned Platteville, of course, and my high school was 400 people total. So when I looked at Penn State, I thought I could really enjoy the opportunities that a really big school had. But then learning about the scholars program really helped solidify it for me, sort of that school within a school phenomenon, the academics, the smaller community, and also, hopefully this is still the case, but there was really good financial aid available also. So scholarship money, et cetera. And so it really made the choice a clear one.
To Eric's last point, we have a student aid counselor now embedded right in the Honors College. So if you have questions about scholarships, financial aid, come talk to Austin. You will be able to learn more about those opportunities. And I did mention Governor Mifflin only because tied into your football origin story here, obviously that's where one of our new star freshman running backs, Nicholas Singleton, went to high school. So there's a nice little connection there between generations.
I went to Governor Mifflin from 3rd to 8th grade. And so a friends of ours that came down for the Auburn game. I just went to the Auburn game. I live in Atlanta, and they were on a plane with his father and enjoyed conversation. So yes, love the connection.
So Eric, what drew you to major in biology? Did you always want to be a doctor, or was that something that you discovered a passion for once you got on campus?
Yeah, that probably happened around the time I was 15, and I had, sort of a long career as a hypochondriac began at that age when I started getting sort of low-grade fevers and abdominal pain after lifting weights at school that day. Kind of went home and instead of just blowing it off, opened up a book in our house and slowly figured out that I had appendicitis. And I told my parents, and we had a family friend who was a surgeon who met me at the hospital and said, actually, he does have appendicitis. And that's not good positive feedback if you are prone to worrying about things. So he took my appendix out and got to know him a little bit and invited me to come, spend a couple days rounding in the hospital with him. I enjoyed the interaction with patients, the scientific aspects, really that one-on-one connection with patients, and thought that maybe I wanted to be a physician. I didn't really have an idea about what kind at the time, but yes. So when I came to Penn State, I thought biology and pre-med was a good focus.
Excellent. And we'll dive back into the academics in a minute, but you mentioned lifting weights. So I was curious what kind of opportunities you pursued on and off campus when you were a student. You listed in our questionnaire kind of a litany of different opportunities that I think would be really good for students to hear, that you can still pursue these and still go to med school and become a surgeon like you did.
So I just had a phenomenal experience at Penn State, absorbing all the stuff that was out there. Just, physical activity. I lived in Atherton Hall, and yes, the jokes about Atherton, but, but these are, it was a great experience. We had a dorm floor that was really into intramural sports and had multiple, like whatever it was, college-wide intramural sports titles. And the whole point of that was you had to show up for everything. So we showed up for badminton and volleyball and, and football and just every sport that was out there. We always fielded a team trying to get those coveted little blocks that they would give out for winning intramural titles. So we were really into that. I swam and lifeguarded at the White Building right across the hall, and then also stayed for summer and lifeguarded in the outdoor pool. I was a Lion ambassador. That was my biggest commitment of time and effort during school. So started that in my sophomore year and continued that through junior year. And that was a tremendous experience and really taught me about leadership and interacting with people from all walks of life, not just on campus, sort of our group, but then, leading tours and interacting with alumni and people who'd gone to school 30, 40, 50 years ago. So that was really a valuable experience. So those were some of the big highlights.
Excellent. And one that you mentioned off campus was the Disney College program, which kind of was surprising to me given that you went to med school. So can you tell us about that program and how that's influenced your career in medicine?
First of all, it's one of those things that probably when I'm 90, I'll keep it on my resume because everyone wants to talk about the summer you did at Disney World. So, I mentioned that I was a lifeguard at the White Building, and one of the women I worked with had just come back from her summer. She's like, you totally need to go. They need lifeguards, etc. The college program comes to recruit at big schools. They came and they needed lifeguards. And I decided to do that and spent the summer at Typhoon Lagoon working as a water park lifeguard. And then the college program also had, once a week you'd meet and learn about business and marketing ideas and how Disney, the Disney Corporation worked. So there was an educational component also. And then, as you can imagine, it was a lot of fun, like a couple of condos full of lifeguards all living in the summer together at Disney. So we had a really good time. So how did that influence my career as a physician? I think just that idea of exploring things that are curious to you. So that was a big journey for me, getting on the train with my bag and going down to Orlando for the summer and just learning to take advantage of all that life has to offer. I think was a good way to set up a career, pretty much any career, but for me, the career in medicine, really exploring things that I'm interested in.
Absolutely. And I know Disney's obviously known for their customer service and the experiential. Did that influence your bedside manner or how you approach working with patients at all?
Sean, that's such a great question. I've never been asked that. It's kind of a combination of Disney and I'm doing it now, even though this is a podcast, but I still point with two fingers, which is a combination of Lion Ambassador and Disney experience. And, that idea that even at 19 at Disney, you always, like, if you had a little bit of scruff on your face, they would bring you a razor to do dry shaving on the lifeguard stand. And just, the idea that you have to get ready to be your best self and look your best when you're coming to work and approaching every guest like they're important, et cetera. I think it probably it probably did influence your bedside manner. You learned that you can be authentic and professional at the same time. And that's a really important lesson.
We've had a few healthcare professionals on this show. We've had a few other physicians. We've had an athletic trainer, a physician assistant. And I think a common theme is that all these experiences that you have in undergrad, whether it's being a cast member at Disney, being in the Blue Band, a line ambassador, working with a volleyball team, they can really influence how you actually put the medicine into practice. So if you're on the fence about med school, I think a key takeaway here is like you need to be involved on campus because that will be a huge impact on you, not just the academic side.
That's a wise observation. I agree with you, Sean. Thanks.
But diving back into the academics, I noticed when you shared about your story with me in prep for this, you earned honors not in biology, but actually in nutrition. So, what was that experience like? What influenced that? And what was your thesis process like?
So I took an honors level nutrition course a little early in my career, and that was with John Milner. And he was probably, I would guess, in his late 50s at the time, and was an internationally known nutrition researcher, and studied how garlic and other supplements had active materials in them that could potentially have anti-cancer, anti-aging properties. So this was sort of at the forefront of the antioxidant time when people were really looking into antioxidants in foods and supplements. And he was really cool. He was smart. He traveled. He was, he had written textbooks, and it's the kind of person that you sort of gravitate toward. And it's funny, I probably had a little connection looking back. My parents were sort of early on the hippie food craze in the 70s. And so as I was growing up, I didn't think of it as abnormal, but they were part of a food co-op, and we had the peanut butter in the big tubs that you'd have to stir the oil in. And, our Easter candy would be healthy and health food and have carob and other things in it. So I probably had this early idea that nutrition was important, and then meeting him and having his class, I thought that would be really interesting. So I engaged with him and decided to do my senior thesis with him, which again, we can get into that, but that was another really great learning experience. It was sort of a negative study. We were looking for the activity of a sort of an esoteric enzyme in bovine milk and cow's milk, and I didn't really find any. So it took a lot of work, and we didn't really find activity of this specific enzyme, but the process of scientific exploration was interesting. And I do have to share one story about that. Part of this was getting the milk. You had to get the milk to get this, to look for this enzyme. So Dr. Milner said, well, you just go up to the Penn State dairy barns and ask the guys for some milk. So I got up to the barns early one morning with my ice bucket and a couple of vials and said, hello, sir, I'm here to get some milk for a study with the nutrition department. And the guy looks at me and he goes, cows are over there. So fortunately, growing up in Plowville, I had gone to a few, agricultural fairs and had a chance to milk goats with one of my aunts. And so I just had to walk up to the stall and find a cow and get to milking. And that was a challenge. That was one of the more challenging aspects of my scientific career. The cow sort of kicked at me, but I left unscathed.
I have to imagine that sometime between then and now, that process might look a little bit different between email and automated milking machines, and just not letting some random student come in and milk the cows. But
Right?
if you're in the College of Ag and have any insights, let us know. I'd love to hear if that still holds true or not.
One of the craziest, science stories I've ever experienced.
That is fantastic. Now, Eric, I want to pivot to med school. Obviously, you applied to and attended med school in the 90s, and I'm sure some things have changed, and you're supervising new doctors, med students, residents in your current role. So I'd ask, what has changed in the process in that time, and what advice would you give to scholars about the med school application and approaching that process?
So, yeah, I've been mentored a couple of actually scholar students through the process. I'm working with one now who's going through the process. And what's interesting is a lot is similar, right? So you're going through the process of taking MCATs. I think people put some pressure on themselves to do well and study and prepare, and their friends and peers have a lot of other things going on. So focusing on that at the same time can be a challenge. And then I think one of the main differences is probably like college, the ability to submit multiple applications electronically and then tailor each individual application with essays has made it more common to apply to, upwards of 10 to 15 schools. And so I think in general, that's probably made it more competitive for everyone. So that process of just finding those one or two schools that really where you have a connection and where you think you would fit is probably even more of a challenge. So that's probably the biggest change is electronic submission. And then in some schools that desire for students to have a certain number of hours of clinical volunteering, which that's a whole nother area. I sometimes worry that inhibits access. I mentioned I was first generation. We didn't have a lot of money and I didn't have the ability to just take a year and go volunteer or work a low paying job somewhere, et cetera. So I worry sometimes that medical schools don't realize that they're making it harder for people who really have a strong desire to get into the field. But regardless, some of those requirements to do some volunteering or some clinical hours beforehand is a change. But that need to sort of write essays and explore the reasons you went into medicine, the need to be a person that they can envision interacting in teams, I think that's similar, but that focus on teamwork and over individual achievement is probably the biggest shift. Although, what medical schools want now is both someone who has all of the individual achievement, but is also really good at team approach, et cetera. So if that answers the question.
Yeah, it does. It does. I think the value of getting involved in different things on campus, where I'm sure you had to work in a team of lifeguards or, and line ambassadors and groups like that, where you gain those teamwork skills. And I think it was also interesting. You said you're mentoring a scholar. You've mentored other ones in the past. Is that something that students, if they don't have somebody kind of guiding them through the process, should they look into finding somebody who can be that guidepost for them?
I'd like to think that it's been helpful. I just in my own personal experience, these students have kept in touch through the whole process and continue to schedule meetings. And then even after they've gotten into medical school, which you would see as the goal, have kept in touch about next steps. Like it was kind of fun. One of them got back in touch when she was wanting to go to residency and making some decisions. Do I go with the city versus, a more rural location? And I think that sort of demonstrates some value is, just having that outside voice who's willing to say, have you thought about X? Have you thought about Y? If you think you'd like another person to have a conversation with, I think it's really nice. And at least in the Scholars Mentor Program, it's not like a therapist that you have to pay. It's someone with expertise, with a connection to the school that's willing to help you. So yeah, it's been great.
And you mentioned the aspect of fit and having a connection. So, can you talk about your med school experience and how you found your fit and what scholars can use as identifiers for their own fit and what might be a good program for them to ultimately select if they're admitted?
I think probably to share, I would want to tell you two things. One is a mistake I made in the process, and it was a good one. So, I mentioned the Disney summer. I really wanted to go I wanted to go to Vanderbilt. I was excited about like going to Nashville, something a little different. And, I had obviously put that I was going to be working with Dr. Milner on my resume and submitted that and the name of the project, but I didn't really totally understand the project yet because I hadn't begun working on it. So that was one of the classic rookie mistakes of my lifetime. So when I got to Vanderbilt for my interview, my first interview with a faculty member was with an internationally renowned nutrition scholar who knew everyone on Dr. Milner's floor, not just him, but the other professors, and was very intimately involved in that exact type of research, and started to pepper me with questions about my project and the people that worked with Dr. Milner at Penn State in that capacity. And obviously that didn't go well. So I was a stammering 20-year-old. And that was just a great lesson for me. I was prepared. I had a great academic resume and the grades and all that stuff. But, if you put something down in your resume, you really want to make sure you understand it. And so it was just a great lesson that even if it's something you're about to do, you want to have a deep understanding of what you're doing, or you don't really want to bring it up or talk about it because it could get you in a little bit of trouble. I ended up going to Emory. My interview at Emory was phenomenal. So it's a city school, but it had a beautiful campus. It had, Grady, the university hospital. It had a VA, so it had all different types of clinical learning environments. But then the first 2 years of didactics were fantastic. They had a group interview, which a lot of people don't apply to Emory because they've heard about this group interview. Why would I ever go to an interview where I was sitting with 3 other students who wanted to go to Emory? And Emory still does that. And what was funny was, and I'm a little bit introverted, I think, by nature, and so that, like, I love one-on-one conversations. So that 4 students and 3 faculty did seem a little bit crazy to me. But it's a test of what you're like in a group environment. And I was with 3 other awesome students. I loved hearing their stories. You sort of would feed off of some of their energy, and it just was one of those interview experiences that is more unforgettable than a lot of the other ones I've had in my life, and just made a nice connection with some of the faculty, connected with the other students that day, and just felt like this was going to be the right place for me. So that was a funny experience. So again, sort of plugging that, don't be afraid to try something that sounds a little uncomfortable. We tell our kids, if you're not uncomfortable, you're not growing. So, get a little uncomfortable, and that's a good way to find a good fit.
And then once you're at med school, what advice do you have for students? Because you said, at the end of the day, that's just step one, really. Like when you're an undergrad, getting into med school is the goal. But then obviously you want to succeed and go on to become a physician. So what advice do you have for students to get through that process in those 4 years?
Yeah, I think that when you said get through the process is an important. I think most people who go to medical school or professional school do have a goal oriented, and they can sort of put things off into the future and work hard to achieve them, sort of we're delayed gratification people. And then you have to really try to make sure you're shifting from get through to enjoying where you are. And I'd have the same advice while you're in college. And, every step of life is, how do you take care of yourself? The wellness aspect. How do you value the relationships and the connections to your other classmates and to your family and to the people that you care about that aren't in medical school with you, so you can talk and listen to them and not talk about medical school? So I think that's super, super important. And then the things that make you excited when you're in school, or a relationship professional that you're interested in pursuing to figure out if you really like something. I think all those things come more naturally if you're well balanced and plugged into the people around you.
That is great advice. Enjoy the process, trust the process, as a certain NBA team might tell you. Now, let's fast forward, towards the 4th year of medical school, and this is typically when folks are starting to think about residencies and then eventually specialties and fellowships down the road from that. Can you walk us through how that process works and how you picked your specialty?
So I'm a transplant nephrologist. So what I do is the medical management of transplant patients. So that is a pretty specialized area. I had done a 3rd-year rotation. I knew I was sort of interested in kidney disease, and I had even, at Penn State, the kidney part of physiology was the part that really clicked with me. So I was interested, did a rotation for a month with a physician who was at Piedmont Hospital. They had a small kidney transplant program at the time. Really liked it. So I was thinking about kidney disease, and you do internal medicine if you want to do specialize in nephrology. So internal medicine is just adult medicine you're generally learning in a hospital setting. And then if you want to go into cardiology or GI or nephrology or rheumatology, which is like lupus and arthritis, all those other specialties branch off of internal medicine. So I kind of narrowed it down to that. And then during your 4th year, you apply in the fall, and you go through this match program. You submit your ranked choices, and then, they rank you, you rank them, and an algorithm spits out where you're going to go. And you go to this big ceremony with all your classmates you're all losing their minds. And, probably these days we would talk about panic attacks and the mental health aspects of match day. And back then we just all kind of freaked out. And, you open your envelopes and find out if you're excited, or some people are crying. It's the worst. Like, if you could plan a bad day for mental, but it was really cool. I think the other thing to talk about with 4th years, whether you're 4th year Penn State or 4th year medical school, is that transition. I think a lot of people feel like that 4th year is, oh, this is your easy year and you can have fun with your friends and take electives. But for a lot of people, and for me, I met someone, and I ended up getting engaged, and she's now my wife. So figuring out, like, okay, I need to match. I'm thinking about a move. Does this person who's attached to me want to do that with me? And moving to a new state and picking a career that you might have to sort of stick with for a lot of your natural life. So what I'm hinting at is there are a lot of stresses in that fourth year that a 24, 25, 26-year-old brain may or may not be totally prepared for. So again, making sure you have those good skills that not just talking and listening to the people around you, looking to mentors and knowing how to take a deep breath and figure things out is really, really important.
You mentioned this idea of transitions. So, what advice do you have for navigating going from probably University Park, maybe one of our college campuses, to, in your case, you went to Atlanta? How did you handle that adjustment? Or, going from Atlanta to your residency? How do you, knowing that you only have so many years in a specific spot before you move on, how do you deal with that?
I guess that does come a little bit natural to me. I enjoy the first, like, that exploration, new place, and sort of walking around. Or so we moved from Atlanta to New York and lived in the East Village, and had a month. Moved there in June to walk around the city and find restaurants or places and dry cleaners and all that stuff. So I guess I really enjoy that. And keeping your mind interested and being curious. I think curiosity, and it's one of the things I talk to the students I'm mentoring about is, again, it should be authentic, but when you're applying, what do people want to see? They want to know that you're curious, that you're not intellectually curious, that you're curious about people, curious about places, and just really exercising your curiosity muscles is really, really important. And I think that helps anytime you get to a new place. It's finding the things that are exciting to you, whether it's food or outdoors or cultural experiences, restaurants, how to connect with others and the place around you.
So obviously, you just mentioned you kind of went from Atlanta to New York, and eventually you found your way back to Atlanta, and you are currently the program director for the Piedmont Transplant Institute. Did I get that right?
Yes.
And you've previously served as president of the Atlanta medical staff. So, how did you end up moving into these leadership roles, and how do you balance the demands of administration and remaining active in the OR with patients?
So one thing, Sean, I'm going to correct it since it's on the record. So again, I do medical management, so not a surgeon. So that's one thing I had to figure out too. I think a lot of times you think about surgery as a career, and standing in an OR for like 8 hours, bundled up in hot clothing and a mask, and not being able to eat or drink coffee was not a fit for me. So again, I do all the medical management, and I have surgeons that work with me, and nephrologists, and what we call hepatologists or liver specialists that we work together for the transplant program. It's funny, if you work hard and care about your work, I think in some ways you can prepare yourself in case leadership opportunities happen, but often they happen in a fashion that is either accidental or appears accidental or sudden. And so that's kind of how things happen to me. I think I had good relationships at work and took my job seriously and tried to do a really good job and help grow the program, etc. And we had a situation where, somebody left suddenly, a person in leadership, and they needed someone to help and step in. And so, when they turn around and look around, sometimes your name is called. And not all leadership happens that way, but I think when you talk to people who've had careers, often it does. It's not that 3-year plan to be someone's successor. It's someone doesn't show up one day and all of a sudden they need someone to help. And so it's that process of preparing yourself so that if there is opportunity, you have the right education, work skills, and history. You've gone to conferences, you've published, you've attended the meetings, and you have good relationships at work. And I think that's that's probably the key of how it happened to me. And similarly with the president role at Piedmont Atlanta Medical Staff, it's something that I was asked to consider, and then took it seriously. So yeah, sometimes good fortune just kind of comes your way.
So you're managing all of these other surgeons and medical professionals, and obviously you referred to the med school application, and there's a lot of high achieving individuals. You have to have that certain level of individual success to even get into med school and then to thrive as a physician and in healthcare generally. So how do you approach actually like nuts and bolts leading all of those folks and inspiring your team and managing them?
Well, it's a really good question, Sean. And I think a lot of probably really good leaders wake up every day wondering if they're failing at a lot of those things. So like, I think if you are at all self-aware, self-critical, you're just, thinking about what could I do better? And I think for me, it again comes back to the relationships. So understanding the people that you work with, listening to them. I could always do better, but communicating what's going on. You think that people know what's happening at your organization or greater forces in either the healthcare market or the world that are impacting our day-to-day lives. But just talking through what's in your head is a really important skill that I think we all need to work on. Just making sure you remember to share what's going on. I think for me, really trying to be the best listener in the room is sometimes not a skill that everyone always would emphasize in every part of your training. But if you can come out of each meeting or room you're in, really understanding the people around you and making some connection to what their concerns or cares are, then that's a big step in your career and in life. So be a great listener, and I think good things happen.
And that is great advice, even if you're not going into medicine, is to be a good listener. Now, going back to the science side of things, and I guess a blend of patient care and bedside here as well. Hopefully, you never have to deal with this in your personal life. And obviously, you go into medicine, you might touch this. But Eric, could you give us a general walkthrough of like the transplant process, like from identification that this is something you need to recovery?
Absolutely. So, kidney disease, especially, I'll focus on kidney transplant. It's something that's often a silent disease. So, people that have had high blood pressure, maybe diabetes for a long time and didn't realize that it was poorly controlled. And those are two common diseases that are known, by most lay people. But there are a lot of kidney diseases like lupus and others that are a little less commonly understood that can start with high blood pressure or protein in the urine and can lead to kidney failure. And for many people, their first experience with their kidney disease is when they have a headache and they're nauseated and they're feeling bad. They go to the emergency room and find out that they're in kidney failure. So we have a lot of patients that haven't accessed the healthcare system, haven't been seeing a doctor for years, and suddenly find out they need to be on dialysis, which is usually a 3-day-a-week procedure. Can be done at home, where people go to a dialysis center, have their blood cleaned and excess fluids filtered by a machine. And anyone who's on dialysis or has less than 20% kidney function would be referred to a transplant center. So they would come to a place like Piedmont or in Pennsylvania. There are multiple transplant centers in Philly, Hershey, Pittsburgh, etc. And they're referred there. They see a team of nephrologists, maybe a surgeon, but a social worker, a dietitian, blood work, etc. They might have some cardiac testing. And if they're passed through the various aspects of testing, they may be placed on a waiting list. Now, you could have a living donor. So if there are friends, and we would encourage or teach them how to talk to their friends and family about finding a living donor. And if they had living donors volunteer, we would test to see who might be compatible. Otherwise, they're on the deceased donor transplant waiting list, waiting for a kidney from someone who's passed away. And that can take anywhere from 2 years to 8 to 10 years, depending on blood type and circumstances and where they live in the country. And then we would see them intermittently until they got that magic phone call, hey, we have an organ for you, where you sort of have to drop everything and come to the hospital. And then that's when that process of our relationship with them continues, where we take care of them in the hospital for that 4 to 6 days that they're in the hospital, and then a lifetime of transplant care that involves suppressing the immune system, preventing rejection, and dealing with any health complications that come with that.
And that's interesting about kidneys in particular, and this also probably applies to liver as well. But the idea of how you coach folks to approach family and friends for living donors. Can you tell us a little bit more about that?
Yes. So many people have a little trouble sharing intimate and personal details about their health. That you can, you could sort of understand how that would be a sticky for some people. And then combining that with asking people to help them is another part. So a lot of people have trouble asking for help. So first, you've got the privacy aspect. Second, you've got the I'm asking you for help. And the third part is what you're kind of asking is really kind of a big deal. So we think, well, we have 2 kidneys, you can give one and live a healthy life, but you're still asking them for a vital organ. And so I think that the combination of those 3 factors can make it hard for people. So we present them with like social media toolkits where that, how could you put this on Facebook and Instagram in a way that's short but meaningful? So, I'll talk to people about, a Facebook post that has a picture of you, and maybe it includes your dog because everyone likes dogs. You and your family, or you and your dog, and just says, many people don't know this about me, but I have kidney failure, and my doctors say I would do much better if I had a living donor. If you're interested, contact Piedmont at the following web address. And just those 3 sentences can make a difference in an extra 20 or 30 years of you living life. So the difference between a living donor transplant and staying on dialysis can be decades of lifespan. Just trying to listen to people's concerns again about what makes them scared to share this information, and validating that, but then giving them a plan that's achievable and concrete that could help them get through that is sort of how we handle it.
I really like that. I know there's a lot of challenges with social media, but it sounds like a really good use for it. And then obviously, we hope for success every time the transplant goes through. Can you talk about the post op and really particularly the lifetime care? What does that look like for somebody who gets, say, a kidney transplant?
So for kidney transplant, the 1 year, we define a lot of success, which is a little silly, but it's the way we do it, by 1 year success. So is the patient alive, and is the kidney still working? And those 1 year success rates of, being alive is close to 98 to 99%. And then having the kidney be working at the end of that year is somewhere between 95 and 97%, depending on the transplant center and unique circumstances. Like the COVID epidemic was a tough year for outcomes and et cetera, but should be in that 95 to 97% range. And liver transplant is similar. So that's something, there's been some real improvements in the last 10 to 15 years, where it used to be more like 88 to 90% 1 year success rates, and now are closer to 93 to 95% 1 year success rates. We're also measured on 3 year success rates, but then we obviously, that's sort of where the government looks at our outcomes, 1 and 3 years. But then again, for lifetime, people need to take medicines that suppress the immune system, and that can lead to infectious complications, as well as certain cancers like skin cancer can be higher risk in people with transplants. And so people do need specialized care, especially for that first 5 years. And then they need to have doctors that understand their medicines, the interactions that their medicines have, and then when to refer them back to the transplant center.
So I'll say I just learned the part about skin cancer.
Yeah.
That's something new to me here right now as we're recording. Eric, are there other misunderstandings or just lesser known parts of the transplant process that you wish folks knew more about or were better educated on?
Yeah, that cancer aspect is really interesting, and that surprises people. I think our most common question, people are like totally freaked out when they learn that we don't take out their old kidney. So like a liver, you take out the liver, you put the new liver in. But for a kidney transplant, you leave the old kidneys in unless there's a specific problem like a cancerous cyst, etc. And you place the new kidney in the lower part of the abdomen, real close to the bladder and the arteries where it's sewn in. I think really important to us is the problems of medication access. So if someone is a veteran, or if they're in the UK, for example, and they have unlimited access to transplant medicines, the outcomes are really, really good beyond 3 years. And in the United States, we've had a real problem where people lose their Medicare after 3 years of a transplant and can lose the ability to afford their medicines. And so just the basics of that we pay so much for dialysis and organ failure, but then people have had trouble over the years at being able to afford their medicines is a real tragedy. And that's really been helped a lot by some specific legislation, whether it's Affordable Care Act or more recent updates to help pay for Medicare, at least the medicine aspect of Medicare. There have been some real breakthroughs, but it's still a real issue for us, is having people have access to medication.
And earlier you mentioned the pandemic. How did that impact? Because, I work in an office. We social distanced. We worked at home. For the surgeons and for the patients, you can't not be right there with each other. So how did the pandemic impact transplants?
So the pandemic had a tremendous impact on just about any healthcare program, but transplant patients and programs specifically. So from late March 2020, when the NBA shut down and all of society stopped, till about early May, we really held back. We did a lot of liver transplants because those are really truly life-saving for people that are really sick. And for kidney transplant, there was a brief period where we had to stop, and most programs programs kind of shut down for all but the most life-saving kidney transplants, and then gradually brought that back to speed. That first year was just tough. We didn't have vaccination, and we didn't really understand everything about the virus. For a while they weren't sure, do we need to wear masks? And then we did, when we figured out that passing it along in indoor spaces was probably the most common way of transmission. And I think in the Northeast, they were hit early on by a big wave. And then in the Southeast, it really took a little while later, until later in the 2020. And so we, like other programs, had patients that passed away and, died from COVID, and gradually planning for people to have safer transplant experiences, from your waiting room spacing, masking policies, to vaccination for people on the transplant list. Now we give a medicine called Evusheld, which is gives 6 months of antibody protection against COVID. So our patients are now vaccinated and they get Evusheld at the time of their transplant. And now I can't really remember the last time I had a patient who passed away from COVID, whereas 2020 and 2021, it was a really difficult time for our program and for transplant patients nationwide. So yeah, the pandemic was, as a time to lead and also as just a patient care provider, it was a really, really challenging time, but learned a lot. Definitely helped my brain in terms of growth, just trying to solve a lot of new problems.
And I'm sure that was really, really stressful for you, and being in medicine is stressful anyway. So and you talked about this earlier with wellness generally. So how do you relax and unwind outside of work? And how do you suggest our scholars could similarly approach that aspect of taking care of yourself so that you can take care of others?
Well, setting boundaries is important. For me, exercise is important. I play tennis, and tennis is social. So it checks a couple of those wellness boxes. Talking to other people and physical activity are both really, really important. So, for me, exercise, getting enough sleep. I have 2 teenage children. So I really, I was able to go to really all of their sporting events. And so, watching them and making sure that they know that they're important, trying to be home for dinner. And, we have a nice group of friends here in the neighborhood. So again, it's figuring out what are the things that you like and that relax you. And for me, I feel successful if I have good relationships with my family and have good social outlets, and making sure that you put emphasis on those things. Absolutely.
And finally, before we go to our general reflection questions, that if you're a regular listener, you know what I'm going to ask. But Eric, I am not a doctor. I don't work in healthcare. I work in the honors college. So is there anything that I should have asked about med school, about medicine, about transplants, or medical management and patient care that I just didn't think to ask of because I don't know, not being in that field?
Sean, I gotta say, you must be a great listener, because you just had great questions, just residency, specialty training, etc. So I was I was really impressed. No, I think you really nailed it. So I don't think I would have added anything to your questions. I was really surprised at your general knowledge of how many things you must know about if you know so much about this process.
Well, I will say I've interviewed a couple of medical professionals at this point, and my best friend's a pediatrician, so I kind of
Wow.
kept up with the process from interviews to residency interviews. So tangentially aware of the process, but I appreciate the feedback. And Sean Miller, if you're listening, please take note of that. So thank you. All right, Eric, what we do here in the last part of the show is I just ask some general reflection questions to benefit all of our scholars. So first, this is your chance to brag a little bit. What would you say is your biggest professional success to date?
Running a transplant program is almost always something that's done by a surgeon. It's usually at an academic medical center. So I co-direct the program with the surgeon, but being asked to run a program of this size and growing it, we're now in the top 10 in the nation by volumes when you add up liver, kidney, and pancreas transplant, and just opened an organ recovery center at Piedmont, which means that when people are going to donate their organs, deceased donors come to Piedmont in a special wing, and they're managed in a way that's protocolized so that their gift is maximized. More organs can be recovered if the donors are managed according to protocols and most correctly. So I think just stepping in to lead that program at a time when it was needed and having it grow and become a program of nationwide importance is something that I'm deeply proud of.
So I do want to ask one more medicine question based on that, because that is fantastic that you've been able to grow that. If you're a scholar listening down the road, you decide this is transplant medicine is something you want to go into, do they seek out opportunities opportunities at a center like yours, or do they go and kind of be on a surgical staff at a regular? I don't know if it's the right word, but like a regular hospital or university hospital, say in like all the ones in Philly or Pittsburgh.
Yeah, usually the training, you're going to go into transplant medicine. If you do either nephrology or GI, you would do an extra year of transplant medicine. Or if you're a surgeon, you do a general surgery residency followed by a 2-year fellowship. Then it's not a match day, right? Then you've got to start reaching out to connections, and most of them are in cities. So Geisinger is in Danville, Pennsylvania. That's an unusual example of a non-city, sort of a rural transplant center. But most are in big cities, and so you would reach out to connections, mentors. Where do you want to live? I kind of cast a wide net in the Southeast and directly reached out to programs. My first job at a fellowship was in Richmond. And then I did have some connections in Atlanta and Piedmont that let me know when something opened up. So yeah, as I was saying, a lot of times, probably 4/5 or about 80% are at academic medical centers, but there are community health systems like Piedmont that run, there's one in Charlotte that run big, successful transplant programs despite not being a classic academic medical center.
Excellent. And we did find something I didn't think to ask about. So there we go. Now, Eric, on the flip side of my two questions back, what would you say is the biggest transformational learning moment that you've had in your career, other than what you called your kind of rookie mistake with your resume, and what you learned from that experience that could be beneficial for our scholars to hear about?
It's hard for me to give specific examples, but I became a chief resident in New York, and so you're sort of the in between. You're not a resident anymore, and you're not faculty, and you're kind of an interface situation. And it's one of your first times that you get involved with, sort of. You think that your 80% of your colleagues are like they're just like you. They're hardworking. They're just doing everything they can, and then some of your problems come from a small group of people that maybe don't have the same professionalism or have some other behavioral or other issues that need to be worked on. And learning young, again, you're 25, 26. And so do you have the maturity and skills to listen to those people to get both sides of the story? That's been something, whether it was line ambassadors, but then chief resident year, and then later on in life as an administrator, really not jumping to conclusions the first time you hear about something horrific, and then you ask the other group, well, what happened? And you find all these nuances and details that make it a really much more complicated story. And so that's probably been a key, is get not just both, but multiple sides of a story before making important decisions.
And I think that's true for anybody, just as a person, not just as a medical professional.
Indeed.
So we've alluded to this a little bit, but let's talk about mentorship for a moment. How do you approach being a mentor, but also you've still got a lot of your career ahead of you? How do you approach being a mentee despite the role that you play in your healthcare system?
In terms of how do I approach being a mentor, it's fun to get to know someone. So just, asking a lot of questions, making sure I understand their motivations, what they're interested in. Most people being mentored want a specific thing, but they also may benefit from talking about some other stuff. So you find out, the people I've mentored, they want to go to medical school, but they often have similar issues that other people have when they're going through the process. They're trying to figure out where they want to live and relationships and family and other things. And so that's important. And I think the other thing about mentorship is not just making it a focus on them, but sharing. So that's something I've learned in the last 4 or 5 years of leadership, is that people trust you more if you talk about yourself a little bit. So not to mentor someone by talking about yourself for an hour, that nobody wants that, but just sharing a few important details about things that have happened to you or something that happened to you yesterday. I think when people don't see you as this mentor, or hey, my teenager hated me this morning, I think just making yourself more regular is really helpful for people to build that trust. And then being a mentee, honestly, that's something that's just a little harder for me, is working on asking, just we touched on that earlier, asking for help. What do you think I should do? And I think learning that people, I know how I feel when I'm being a mentor, and so giving that to someone else as a gift is really important. So I've realized that when you make that appointment or have coffee with someone and ask them for their opinion on something, they feel good about themselves. And learning that that's okay to make yourself vulnerable, and that person is probably enjoying that process, is something that's been good for me to learn.
Now, you mentioned earlier, Eric, when you were interviewing at Vandy, that the professor there knew all of the professors in the department here at Penn State. So in medicine, it's not the biggest field, there's probably a lot of connections and known webs of connections throughout. So how do you suggest that students, outside of something like mentoring with honors, which and opportunities in other colleges and campuses here at Penn State, how do you suggest that students go about finding mentors, whether it's now in college or in med school or beyond?
You wouldn't want to get too far ahead of yourself. Like if you're in college, you probably want to focus on mentors that are more local to you. So as things move along, so if you're in residency, you're going to have peers or people 1 or 2 years ahead of you in training. So, your residents that are supervising you, or a faculty member that you meet who, sort of lights something in you that you might want to explore something more deeply. Or, you go to a conference. So that's a big one. Doing some research, anything that's independent or original will get you involved with other like-minded people. And even if that's not the path you choose for the rest of your life, it's an avenue to meet other, interesting and motivated people who are different phases of their career. So yeah, I think travel and being awake and aware to the people that are around you are really the two biggest areas.
Excellent. And speaking of people, are there any professors or friends from your days at Penn State that you want to give a shout out to?
My like the three guys that I hung out with the most on my dorm in the first year are the ones that I still keep in touch with the most. So Mike Baska, who I lived in it was 356 Atherton Hall for 3 years. I've never met anyone who stayed in the same room for 3 years with the same roommate, and then we moved off campus with a group of 5 of us. So Mike Baska, George Motley, and Doug Hoover. We entered as freshmen together. We had a lot of good times. So those are the three that I wanted to say hello to.
Excellent. Now, as we're wrapping up our time, is there a final piece of advice for students, whether ones who are looking into medicine or just Schreier scholars generally, to make the most of their time at Penn State that I just didn't ask a question that it was a good answer to?
I think people know this, but the Schreier experience and being at Penn State as an honor student is it's tremendous. Your access to coursework, the peers. And I think that's probably the advice I'd give to people is really appreciate being surrounded by smart, interesting, fun people. Like there just aren't that many times in your life, really there are very few, where you can live and, breathe and study around just so many brilliant and really fun and interesting, curious people, and really appreciate that.
I will certainly echo that, Eric. Now, if scholars want to reach out to you and connect with you and take this conversation a little bit further, they have questions based on what they've heard, how could they connect with you?
I'm on LinkedIn, so Eric Gibney, have a LinkedIn profile and happy to connect. I've had a few people connect with me that way, so that's probably the best way to reach me.
And finally, if you were a flavor of Berkey Creamery ice cream, which would you be? Not your favorite, but which would you be? And most importantly, rationalize this, Eric, for us. Why would you be that flavor?
Okay. So I did get a little bit of prep on this one because, there are so many creamery flavors now, and I want to get this correct, right? So I would be Crazy Charlie Sundae Swirl. I always like the peanut butter versions of Penn State Creamery ice cream, but the fact that there's now one with chocolate also makes me, just first of all, that's what I would order. And then, it's vanilla, it's peanut butter, it's chocolate. It's a combination of a lot of things. And so I think at any phase in your life, you're a product of a lot of different experiences that you had. And if you can swirl those all up in a good blend, then hopefully that makes you a good, complete, and, like an ice cream cone, very good. So that's the one that I gravitated toward.
Well, I can say you were the first person to choose that one. So
Really?
you have the first tick on that one there, Eric. Dr. Eric Gibney of the Piedmont Transplant Institute, class of 1994, here at Penn State and the Honors College. Thank you so much for joining us and sharing all of your great advice and thoughts on the medical profession and med school for our Schreier scholars. We really appreciate your time today.
Thanks, Sean. Really enjoyed it. Have a great day.
Thank you, scholars, for listening and learning with us today. We hope you will take something with you that will contribute to how you shape the world. This show proudly supports the Schreier Honors College Emergency Fund, benefiting scholars experiencing unexpected financial hardship. You can make a difference at raise.psu.edu/Schreier. Please be sure to hit the relevant subscribe, like, or follow button on whichever platform you are engaging with us on today. You can follow the college on Facebook, Twitter, Instagram, and LinkedIn to stay up to date on news, events, and deadlines. If you have questions about the show or are a scholar alum who'd like to join us as a guest here on Following the Gong, please connect with me at scholaralumni@psu.edu. Until next time, please stay well, and we are